White coat hypertension. What's white coat hypertension? Well, that's a patient that comes into my office. The patient's been hurried, stressed, barely got in on time. It's hot in the waiting room. He's got so many things to discuss. And I've only got like 6, 7, 8, 9, 10 minutes to discuss all these issues. So what happens? We take their blood pressure, and their blood pressure is up. Now, is this their real blood pressure, or is it because they're stressed? And as a physician, I have to determine that. So I don't want to treat them based upon this one reading. So what are my options? My options is bring the patient back. Also, another option is have the patient check their own blood pressure every morning. And I recommend patients go out, buy a blood pressure machine, and check your blood pressure every morning, first thing in the morning when you get up. First thing in the morning, your blood pressure is always a little bit higher because of the blood pressure surge. I tell people, take your blood pressure, take it first, and then 2 minutes later, take a second reading and write them both down. And then when I have the patient come back in 1 month, when they come back in 1 month, I can just see what's their blood pressure been. Because if their blood pressure at home is 135 or less, or 85 or less, I know they don't have high blood pressure. So the white coat hypertensive is a person that runs in the office, his blood pressure is high, but when he takes it at home, his blood pressure is great. So that person that has white coat hypertension may not require medication today, but he definitely requires lifestyle modifications. So be it decreasing stress, be it dietary intervention, be it increased activity. Because someone with white coat hypertension, he's prone or he's at greater risk to developing hypertension. So if you have white coat hypertension, you have to work seriously and diligently to decrease your blood pressure.